All right. Welcome, everyone. This is a hybrid seminar, so in person, we're also online. My name is James Orbinski. I'm the director of the Dahdaleh Institute for Global Health Research. It's really wonderful and exciting to be able to introduce Professor Shital Desai. He's a colleague, has been here at the Institute for some years and made major contributions to the Institute. Shital today is going to talk about empathy by design, tailoring life-centered solutions for seniors and individuals with dementia. It's a case study, and we're going to really explore some core design principles. But before I tell you more about Shital, I'd just like to begin with a land acknowledgement just remind people who are online that a land acknowledgement is about the land you are physically on. I invite you to take a moment to acknowledge the land that you are physically on. And today we are here on York University campus in Toronto. And York University is located on traditional territorial area or areas known as Takaranto. And its current treaty holders are the Mississaugas of the Credit First Nation. And there are also many other Indigenous nations on this land, and they include the Anishbek Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis. And the territory that we're on, the Great Lakes region, is subject to the Dish with One Spoon Wampum Belt Covenant. And this is an agreement to peaceably share and care for the land that we are on. And so with that, I'd like to just give a very brief introduction of Shital. Professor Desai, Shital Desai, Professor Desai is an associate professor in interaction design at the School of Arts, Media, Performance and Design. And she's also a research chair in accessible integration design here at York, and the co-lead of the Connected Minds Training Committee. And that's a massive research undertaking here at York, about, I think it's, what is it, $320 million funded research program. And Shital is playing a major, major role in that that research program. Shital has about 30 years of experience in robotics and in participatory design, and she leads the innovative Social and Technological Systems Lab, which is supported by the Canada Foundation for Innovation. And I will say that pretty much anything that's supported by the Canada Foundation for Innovation, it's pretty high level. And I mean that in the sense that it is extremely well regarded by other academics or by other peers. It has a very high probability of actually catalyzing significant change. So I think what you're kind of hearing from me here is that, and you were just recently tenured, right?
Yes.
Yeah, just like
in May.
in May, yeah. I think what you're hearing from me is that Shital is a very significant leader in the world of research, and most especially in the world of design. And what she has been involved in here at the Institute over the last number of years is bringing design concepts to global health and to how we approach global health, and how we design research agendas, and then also how we design implementation strategies, I think is probably the best way to put it. And what Shital is going to present today is a case study or an example, and hopefully at least the PhD students have done the background readings And then we can obviously discuss those following Shital's presentation. So the last thing I'll just say, I don't want to sort of keep going on about how wonderful you are, but you are pretty wonderful. We did a seminar series here last year on design and global health. And Shital really led that process with myself and with Bruce Mao. And Bruce Mao is one of the world's leading designers. Bruce and Shital and myself designed a series of seminars around how to bring design concepts to global health. It was very, very successful. And Ripsha was actually involved as well, deeply involved in one of the major case studies. And a very successful workshop, or series. It wasn't just one, it was actually 6 workshops over an academic year. And we're actually going to put that together as a book at some point in the next little while. So it's just really a pleasure to invite Shital, and I'll just turn it over to you.
Thank you, James. And I wish you could just keep continue talking and you could just finish this seminar. But I really appreciate those kind words. And thank you for this opportunity as always. And thank you for accommodating this time beyond after the semester is over. And hello, everyone. Nice to meet you all. And I've heard lots of good things. I have met some of you. And it's nice always to meet new students, and especially PhD students. I'm going to talk about, I have 25 minutes. I'm going to talk about methodologies, and there's a lot of interest around co-design and participatory design. And I'm going to talk about these methods that I'm applying in this project with older adults and people with dementia, and specifically around designing technologies, products, services, including policies as well. And it is inspired by around this problem, which is the digital divide. And if you see this, there's lots of red, very little green. It shows, how much is this a critical problem. Where is the digital divide? A lot of our services are becoming digital. You go to a bank, if you are accessing that service physically, you are charged. And there was an article on CBC News where, increasingly banks are avoiding. They want you to access all their services online. What happens to people who are not familiar to those services? What happens to older adults? Like we know from our work with older adults, they struggle to access a lot of these services online. But it is also about people with disabilities. And we just yesterday celebrated International Day for Individuals with Disabilities. But what is disabilities? Is it only people who use wheelchairs or people who are vision impaired? But disabilities are created by the systems that we live in. And you all know from Tara's presentation what systems are. But the disability is caused by the lack of abilities, which could be physical or cognitive, but also access to resources. A lot of folks in the rural communities don't have access to Wi-Fi. How can you design technologies which rely so much on cloud computing and Wi-Fi and internet? How are these people going to access your healthcare services or your banking service? But affordability is also an issue. A lot of people can't afford technologies that we're designing. A lot of people are socially, economically marginalized. You see some of these people are new immigrants and refugees. But there's a lot of people who have combination of these barriers and challenges. So if you imagine an older person who is an immigrant or a refugee, who is socially marginalized or economically marginalized, the barriers keep increasing and they get more and more isolated from this digital revolution that we are looking at. Human-centered design is an approach where we say we are going to involve people, and it used to be users. Decades ago, it was all about involving users of your policies, interfaces, technologies in the research and design process. But we know that just involving users is not going to solve the problem. And from your systems design approach or systems thinking approach, there are a lot more people involved in the system. Is it coming from me?
No.
So there are a lot more people or stakeholders who are involved in the system.
I just wanted to ask the people online to please mute your microphone. Thank you. Go ahead.
So there are a lot more people. So if a person with dementia, they're healthcare practitioners or caregivers, and other people, and the context or the environment in which they operate, we need to keep those environments in mind as well. And that comes from your systems thinking approach. So we need to involve humans, but involving humans creates more problems now, because humans, they always use their own attitudes and personalities to do something. And it creates a lot of sustainability issues, because we're not considering the whole planet in perspective. So from a human-centered design approach, we're now starting to move. So a lot of people are saying human-centered design is not enough. If we want to follow a systems design approach, we need to have a life-centered design approach. The difference is that we don't only involve humans, that is the stakeholders, but we also involve animals, birds, all living beings, but also the environments, the land, for example. And this also brings in the indigenous knowledge frameworks into perspective, where we're thinking about the whole planet and everyone in that system, rather than just cherry picking some of them in your design process. The other thing is that human-centered design process is often not used appropriately. Most of the designers will develop something and expect people to learn how to use it. And the only human-centered approach they incorporate is just testing it with people. The life-centered design or human-centered design approach requires that the stakeholders should be involved right from the start of the research and design process. I keep using the word design quite a lot, but the methods I'm going to talk about are research methods. And a lot of this work is a research focused methods, not knowledge dissemination. So it is always an incorrect misunderstanding that, oh, design is only for knowledge dissemination, and we're going to make this posters and videos, and that is not what we do. So and you will see that there's some parallels in what you do in your work as well. In our work, we use something called double diamond approach. And here you can see there are two diamonds, but it's not like a linear process where you're going from one diamond to another. There is a lot of iteration, like going back and forth. I don't know how many of you all know about divergent and convergent thinking, but what it means is that when you are divergent thinking, divergence is all about exploring. And if you can think about your data collection process or literature review, for example, you always start broad. That is, you are doing divergent thinking. You are exploring lots of other keywords, context, who are the people involved. So you're always starting broad. And convergent thinking is all about when you start coming to a focal point. So if you see the first half of the diamond, we try to understand the stakeholders and the environment, what their behaviors are, what their experiences are. It may be about emotion mapping. It may be about barriers and challenges. And then we do data analysis. In your terminology, it is data analysis. So we have collected all this data in the first half diamond. Then we analyze the data. In double diamond terminology, it is defining the findings or finding insights from the data. So you have gone around exploring the whole forest, collecting all the data in the forest, and then you're trying to analyze. And your research question is important, right? So you're going to use a research question and find out the specific findings. Second diamond is where you start implementing ideas. So you have these findings, and then we start coming up with ideas. And we come up with as many ideas as possible. So that's why it is, again, divergent thinking. And then we'll do some feasibility mapping, which ideas are feasible, and the feasibility could be about, do we have technology to implement this? We do user evaluation or stakeholder evaluation. That is in the last half diamond, where we start converging. We say, okay, we're going to make this prototype. We're going to test it with the stakeholders. And then we may think about like commercialization or open source. And that's where the knowledge dissemination or knowledge translation comes into picture. You'll see a storytelling mention over there. So when we are at stages where we are interacting with the community, we use this storytelling or narrations of experiences. And that is where the research methods largely focus on. How do we get people to tell their stories? Are you going to tell me your story if I ask you, oh, can you tell me what you did this morning? And you're going to say, oh, I had my cup of tea. I had a good morning. But that is not what I want when I'm designing for you as a prospective stakeholder or a user group. I want to really go into your mind and understand what your expectations are, what your experiences are. People are normally not very comfortable talking about negative experiences. So how do you make them comfortable, talk about their experiences, their wishes and expectations? We use a lot of this participatory design and co-design. Both these approaches, and they're interchangeably used, and in Connected Minds, they use the term co-creation. And suddenly there is this increase in the usage of the term co-creation in Canada, I'm seeing, and people use it in different ways. But co-design and participatory design have been research methods in design discipline for almost a decade. And the main, the commonalities between the two is that it engages communities and stakeholders, right from for the entire double diamond process. So right from the start of the research and the design process, we will involve communities. That's a common thing. But they differ in the focus and execution of those methods. So in co-design, for example, the designers take the role of a facilitator, and the participants or the stakeholders will be actually driving the data collection themselves. So they come together. So you see that is a co-design process where you have all these different stakeholders sitting at a table, and you have a number of tables, and they're all talking about their experiences. So a technology developer may say, oh, we can design this technology. And an older person may say, but that's not going to work for me because in the past, this happened. So you see the storytelling, people are now comfortable talking about, and we've seen so much engagement in these sessions where people want to talk about what happened to them. And co-design focuses on an understanding that everyone has a creative skill. And a lot of these sessions happen where people are making things, they are building things. So there's a lot of making and building where people are doing something. So you'll see in that image where people are making something, they are maybe drawing something. Participatory design, on the other hand, still assumes a traditional approach of the designer or the researcher is in power. So interviews, for example, there is still that power imbalance, right? Like I am asking you very specific questions and you're going to give me a specific answers. On the other hand, in co-design, the questions may be generated by the participants themselves, right? So, but that does not mean that you can use co-design and participatory design everywhere. You may have to resort to some of the traditional methods like ethnographic methods or self-ethnography methods. So we use something called observation methods, which is an ethnographic method. We may participate. So for example, this project was about understanding interactions of people with dementia with mixed reality technologies. So we are trying to create these prompts and mixed reality technologies. And we wanted to understand if people really perceive those prompts, are they able to use these technologies comfortably? What is the caregiver's perspective, for example? Now, we couldn't do this in a workshop setting because we really wanted to closely observe how they are interacting. People may not be comfortable sharing their discomfort with the technology, so they may refuse to participate. But it could be another context where if you are studying sexual abuse in people, you wouldn't want to do that kind of a study in a workshop setting. Here you could participate so people were playing games and we participated. So the researcher participated in the gameplay. So we use the word co-discovery. But you could be just a fly on the wall, like you're not doing anything, just sitting in a corner, observing them, what they are doing. So you're not participating in the gameplay or the activity. But if you're participating in the activity, you could have that discussion, the verbal protocols, and that itself could be a data. So you don't need to do another interview, but that conversation you have with the other player who is a participant, that itself could act as a data. You could do retrospective interviews, which is after the observation study. Immediately, you could show the participants the video of the activity or the gameplay in this case. And you ask them to explain what they were doing, why they didn't do this thing. So you could also, on the spot, ask some questions or clarifications, which could help you for analysis as well. This is a controlled observation study. So this is at UHN home lab. So the home lab is a controlled environment at TRI UHN where you have cameras. We never use those cameras. We just use those conventional tripod cameras. But there is a kitchen, living room, and a bedroom. And we ask people with dementia to do a set of activities. We observe them. And they're wearing eye tracking glasses. So we can see where they're looking when they're doing activities. The objective is to explore how eye tracking or gaze information can help identify when people are losing track of their activities. Okay, so this project is one of my master's students. It's Rupsha's thesis project. Here Rupsha was, and Rupsha, correct me if I'm wrong. So here Rupsha was studying how activities change or rituals or habits of people change, people with dementia change after the diagnosis. For example, people change in fact, most of the people with dementia stop reading books. But some activities, they'll do it differently. So for example, we all have a ritual, like when we're having our morning cup of tea, we have it in a certain way. If that changes suddenly, you may stop having your cup of tea. You may ask someone else to make that cup of tea for you. What impact does that have? Imagine if I wish that never happens to you, but imagine if you injure yourself and you can't walk and do your own things yourself. It affects your quality of life. And for people with dementia, they have to live with that poor quality of life for the rest of their lives. So the objective of all the projects is how to empower people with dementia so that they are independent in their activities, but also they can do it themselves. But they also have a choice or autonomy, as we call. I need to have a choice myself, what tea I want, what temperature I want, and how I want it. So for that, I should be able to make my morning cup of tea myself. So here Rupsha used something called co-discovery. So she interviewed a caregiver and a person with dementia at the same time. So what helps in this case is if a person with dementia says something, there may be the caregiver may say, "Oh no, mom, you said something the other day how about that? So you can see the verbal protocols, the conversations they're having, that itself can have very invaluable, rich data. This is a project which is led by my postdoc, Somay Nam. So here we are trying to look at use of artificial intelligence as a responsible technology. So we're trying to use life-centered design approach to design AI-driven buddy or a companion. So for now, this is a cat. And the person with dementia is going to see this buddy or a companion on an interface. And this also, all these projects are connected. So Mindwell, the double diamond approach, where you're going back and forth, every prototype or every iteration informs a new research question. So the observation study that we did with people with dementia, we found that people were the sound prompts or voice prompts. So when the prompts are given as a speech, especially from a human voice, people with dementia were able to perceive or understand those prompts more effectively and correctly as well. And this, we think that this is probably because they are familiar with those prompts coming from their caregivers very often. And also because the visual cognition is impaired in people with dementia. So some of the symbols or icons you use, people with dementia may not be able to understand. So we started looking into how we can use voice prompts for people with dementia. So we're using conversations between this buddy, and the background there is an AI, generative AI, generating prompts, and those text prompts are converted into voice. And the conversations, on the other hand, from the human side, the speech is converted into text and generative AI, But then this project is leading into other branches where we are now looking at how can this visual thing generate emotions based on the conversation that is happening. How can we take this, model this, and put it into an augmented reality? So we can now see like generative AI and AR, so like two emerging technologies merged together. But here we are using something called research through design, or you can also say research creation, which is in Tri-Council grants is a very common term used. So we may design something and then study with people, and that informs a new research question. And in this case, it has given us a new research project itself, like looking at conversation analysis. So we don't even know how conversations happen between humans who do not have cognitive impairment. So we are mapping these conversations in a kind of like, how we do your systems map. And if we can compare the conversation maps for people with dementia and for people without dementia, but also younger people, we are seeing a different trend altogether. And that's leading to new projects. So we collect all this data. What do we do with it? And there is a lots and lots of data, because narratives of people who have worked with qualitative data, the narratives are rich in information, and often people talk a lot. They don't know the research question, so they will often talk about other things as well, and we want them to talk about it comfortably, so we don't stop them. But what do we do with that? So a very common method that some of you probably know is called thematic analysis. So if we have video data, we use Observer XT, which is a software for video analysis. But we also use Atlas TI. If we have audio data, we transcribe it. But Atlas TI also allows us to directly analyze audio data or video data. But transcripts work better in Atlas TI, but it's a similar software similar to NVivo. We also do something called visual analysis. So one of my students is studying, and for a master's thesis, is studying how intergenerational knowledge transfer happens in Mayan communities in terms of learning weaving skills. So how can the older generation transfer that knowledge to younger people. So there is more people taking up this skill. And she is using something called photo voice method, where people take photographs, participants take photographs of their own context, their own experiences, and then they do a focus group and then they talk about why they took this photograph, why is it important for them. And then we take all those images and we may do just visual analysis. This is a visual diagram or a visual map coming from Observer XT. If you just look at a comparison, one is for older adults without dementia, one is for with dementia, and you can just see the visual map is different. But you can go deeper into it, and it just maps out the codes, the themes that you have coded, and it's the x-axis is time axis. So you can see the sequence of codes, a sequence of events that are happening. So you can also do lag sequential analysis if someone's conversant with that in statistical analysis. You can do probability of one event happening after another event. You can use your AI models to come up with probabilities as well. But we do a lot of visual analysis as well with the visual maps that we get. We also do systems mapping. So that's like what you do, your systems thinking maps. So if you're doing a multi-stakeholder, the double diamond approach, in the first half diamond, if you're collecting information from different stakeholders, you can map, do a systems map. You can come up with these different variables, find the relationship between the variables, and then find out the design. I don't know how much you know about like frozen variables, like the loops in systems maps. If they're stuck in the system, you can find an intervention to release those variables. There may be negative variables, like they are positive things contradicting negative things. Then you can come up with systems design solutions. And then we use the ideation process to come up with different ideas. But we also use something called iceberg model, which is, I'm not going to go in details, but what we normally in systems maps, what happens is systems mapping process happens is researchers only focus on the top level thing where, if you're involving only your policy developers and people in administration or secretariats in terms of coming up with the systems map, you're not looking at the stuff which is underneath. And what we do is we primarily focus on people associated with the beliefs. So beliefs are the parts where people who are consuming your policies or technologies or services, if you don't change the behavior of those people who are consuming those products, or you don't understand their behavior, your outcomes are not going to be, or the outcomes are not going to change based on the perspective of only limited groups of people. So when you do your first half double diamond and you involve everyone associated with the outcomes, structures, and the beliefs, it ensures that you're covering the entire iceberg. And what that means is that you're going to design something which takes care of that whole iceberg. And the metaphor is very useful, right? Because you want to protect that iceberg. So I have given an example of people with dementia, older adults, but the same methodology, we use it in a number of projects. And I've highlighted the projects I'm doing with global health, and Imran is there. My boss is here, Michael is here.
You have so many bosses.
It's a water treatment optimization project. And this is where, Michael is leading. And thankfully, he's looking at co-design and applying co-design in terms of what I've mentioned today, and really looking forward to, using this methodology and developing some very specific tools for that project, because you need those creative tools, and every co-design project will have a different set of tools. But primarily the objective is to focus on health and well-being of the community. And that health and well-being could be mental health, but there are lots of systemic barriers. So just saying that I'm going to design for someone's mental health is not enough. You need to be very, very specific in your research question. To summarize, we need to engage with communities and people associated with the entire iceberg. And it needs to be an inclusive engagement. So you remember the digital divide, you need to include the people in the red zone as well. You need to have people with, the immigrant community, for example. And a lot of these people in terms of technology design, although they may be using participatory design, co-design, and human-centered design or life-centered design methods, a lot of the people in the red zone are not included in the community engagement process. Responsible design of technologies. So you need to design technologies that they don't harm the system, the iceberg. So if you are saying AI, AR, whatever, you need to have the life-centered design approach. Make sure that not only the iceberg, but also animals, plants, nature, environment needs to be taken care of along with the humans. Slow design and slow interactions is something which we are exploring in a lot of interaction design projects. And I like to give the example of the telephone. I don't know how many of you all know that telephone. Like my daughter, when I showed her this telephone, and she said, "What is this, Mom?" And she was very excited dialing it. Like my in-laws had this phone when she visited them when she was very young. But you need to slow down. Like the interactions have to be slowed down. Like everything around us is very fast. And so when you are designing, you don't have to measure. And a lot of the designers, when they do human-centered design, and I can say my postdoc always talks about usability. I want to measure how fast people can complete this task. I said, no, you need to slow down. You don't need to measure this speed parameters. You need to be like Italians, slow food, slow interactions, right? Is anyone Italian here? Systems design is very important. And the thing is, like everyone in global health knows systems thinking, but designers don't know systems design. So there's so much to learn from each other. And there is a great need to have this social awareness about accessibility, which is more inclusive. So when you talk about sustainability, and York University talks about sustainability a lot, but sustainability is not going to work just by focusing on material sustainability. You need to have inclusivity, accessibility, without which sustainability is not going to work. So you need to redefine what sustainability is. And I think that is what I have. It's not great.
It is. It just froze on the main screen.
Okay. Right. Yeah, that is what I have. And thank you for listening. I'm happy to.
So I just invite people to comment or offer some questions. And just raise your hand so I can get an idea if people wanted to comment. But Shital, I just loved the presentation, and especially the iceberg. I thought that was really great. And I was thinking that you can actually match that iceberg, the outcomes, the structures, and the beliefs. And the key thing there that was so interesting was that, as you pointed out, was that you actually have increasing leverage the further down the iceberg you go, right? So with your kind of summary points, I think you can organize those according to the iceberg, right? So you could say, for example, the community is the expert. So that's at the bottom of the iceberg, because that's really about beliefs. And then social awareness would be next. And then slow design as an approach. And then systems design. And then responsible design. And then finally, systems design technology as the tip of the iceberg.
Right.
But we focus largely, almost always, we think about the tip. What does the app look like, right? But in fact, what you're asking us to do is to actually say, no, start down here at the bottom, right? Around beliefs, and engage the structures, and engage to understand how the user or the person is affected by structure, and then how they experience that, so that you can design interventions that improve outcomes, right? So yeah, I thought it was excellent.
I wouldn't have said it any more better. Thank you. But that alignment, I think, is very interesting. Oops, I hope you're taking notes.
Yeah.
I think we should create a new iceberg.
Yeah, I just put the, yeah, 'cause
with
I think,
this.
yeah.
But the one which I showed you, we use that model, and we have developed tools to engage with people. So when we have this workshops with different stakeholders, we use this stakeholder mapping to talk about like structures. So structures is all about like what resources people have access to. And then people talk about, so we use that as a guideline when we are doing this community engagement, because we are just becoming facilitators, but we don't want people to, go in a completely, we need to make sure that we're collecting the information that is relevant to the project, and not, sometimes people start gossiping, and we have to like had some really interesting, discussions where people are saying, oh, we cooked this today and that. So.
Go ahead.
Thank you, Mr. Shital, from the screen.
Just introduce yourself.
Yeah, my name is Tarek, and I'm a student here at Shital, a small member of Dahdaleh Institute. Thank you so much for your presentation about different designs, etc. But I have one comment, and I'm not sure if you agree with me, that when we're talking about like seniors and people with dementia, probably we are not talking about like a single population, especially when we talk about dementia itself. Might be like on different levels. So might be very mild and minor to severe level with some cognitive impairment. So here my question is, if I want, for example, to select like a certain design, or even as you as researchers, on which basis you select that design if you are dealing with different population? Or are you, for example, considering certain level, so you are using single design for your research?
Yeah, so that's a good question. So there is no one design that works for everyone. So when we do the studies, and the examples I showed, they're all early stage dementia population, and the objective and the research question is important. And what we're looking at is how to support people in the early stages of dementia to live in the community. That is, we want to delay the transition into long-term care settings. We know the quality of life there is very poor. One of the things that we can do with technology is to support people in the early stages of dementia to do their everyday activities by themselves, independently, and with autonomy. When I say autonomy, I'm referring to that this is the tea I want, and I want to make it myself. It gives any individual, not just people with dementia. A lot of these things I'm talking we'll find that it is common with everyone. I want to do things myself. I want my laptop. I don't want this computer. And we had this discussion, like when she asked me, like, do you want your laptop? I said, yes, please. So autonomy and independence is important for everyone. And so is with people with dementia. But to answer your question, we do studies only with people in the early stages of dementia. So which means when we come up with ideas, they will work only for people with in their early stages of dementia. It may not work for people in the long-term care settings. So if you want to do a study which works, then we need to involve population from the long-term care settings. Maybe nurses should be involved as well.
Oh, go ahead. Sorry. Yeah.
So my name is Anne. I'm an IBRT. So this is a very interesting study. Thank you for that. I wanted to find out, dementia is a combination of different symptoms, like how the person is thinking, how they are feeling, how they are able to engage in their activities of daily living from time to time. So I wanted to know, with this capital aspects of the study, did you look at the individual-centered solution aspect? I know in the beginning you talked about human beings bringing in their attitudes and other things, but then with the digital stuff, are you looking at making it individual oriented? Because people have different lifestyles, different experiences, and how they are responding to the dementia symptoms.
Yeah, so when we do that first half diamond, when we bring all these people together, the other thing you should also keep in mind that we just don't use one methods. We use combination of methods. So I may go and do an observation, contextual inquiry, like just go and observe the settings or do an observation of how people actually do activities in their homes. And then I may do a co-design. So we never do a workshop as a first method. We always find out about the context, and we use the term called contextual inquiry. And the contextual inquiry could happen by doing a home tour, like go and observe them in their homes, talk to the caregivers, talk to community partners. We may interview people. So we do the use conventional methods or participatory design methods before we do the workshop. So when they come to the workshop, we already know a lot about those participants who come there. And we try and incorporate everything that you're talking about. So what we have found is there's a lot of common things. The barriers are very common. The expectations are common. The wishes are common. Things may change when there are cultural implications. Like, for example, in Ruksha's study, we found like people from certain cultures do certain things, like making a cup of tea. Like I make my cup of tea in a very Indian way, which is very different. And when I get a British tea, I don't like it. There's no ginger in it. There is no cardamom in it. And so cultural implications will come into picture. Social structures may come into picture. So some of the cultures, they have a hierarchy in, and people from social sciences probably can tell better about this. There's a different, the upbringing is different in some cultures. That may have an impact on how people with dementia age at home. And we need to take those things into consideration. We may create categories saying, okay, we don't want to compartmentalize people, saying, oh, you are from India, this technology is for you. We need to have a more inclusive approach, and people should have options or settings in a technology where I can choose. Like we found, like one of my master's student, she's studying smartphone design for her grandparents who are Persians. And what we found is that a lot of these technologies don't have an option to choose Persian as a language because there's a misconception that Persian language is same as Arabic language. So she's trying to design to help her grandparents use her smartphone. So, so such things may come into picture when people start talking about, I can't use technologies because there's no language option for me. Does that answer your question?
That's fine, thank you.
Dr. Rowe?
Something like that is.
It's okay. Then we'll go.
So you
Just introduce yourself and nice and loud.
So I'm Dahdaleh. I'm a PhD student here. So my question is, so you started with the digital divide in the slide number 1. So, and then there are a couple of projects, and then especially due to dementia, and there are other kind of more than 10 or 12 projects related to based on the digital technologies. So how these projects are going to address this digital divide? Because ultimately, I couldn't see the population who had not access to the digital, the ability and affordability and the capability to use the digital technologies. So how kind of those people were taken or pulled up to use this digital technologies beyond the dementia project?
So if we use, and every project has a research question. So I gave you examples of people with dementia. So when we do studies, we try to be inclusive. So a lot of our studies, so one thing you have to keep in mind, when you design for the extreme population, it works for people in between. And if I can explain that, so if I design for people with dementia, it will work for younger people as well, and also for people without dementia. That is a very inclusive design approach. So we always design for the extremes. It is like planning your finances. You always plan for the worst come scenario. So you always design for the extremes. For people with dementia, so the queuing technology, for example, that projects which I showed you, they're all prompting people in sequencing tasks. People with dementia often forget, not often, but they always forget when they're doing an activity. If I'm making a cup of tea, like if I'm talking, giving this talk, I'll suddenly forget. It happens with us many times. It happens with me. And Ruksha will tell you how often she has to remind me, you were talking this. But that is because we have just too much work on our plates. People with dementia live that life for the rest of their life. They cannot finish a conversation. They cannot finish making a cup of tea, for example. And we need to prompt them, so technology can prompt them to sequence that task. So, but the technology has to track when they're losing track. You don't want to be a GPS telling turn left, turn right. You know how annoying that is. I often switch off my GPS or switch off the audio because I don't want to listen to left, right. So you don't want the technology to do that. You need to give them the autonomy. So that queuing thing, now we are trying to apply it to a gaming scenario, because we found that, when people are playing games, younger adults are playing games, it's difficult to understand the rules of the games. So Sony, for example, is interested in knowing how we can apply that queuing technology or queuing process to develop their games. PlayStation, for example, they tried to come up with this AR PlayStation, and it's not very successful now. So how can we use that queuing process into gaming so that when people are playing games, it can prompt them to do certain things? When we are playing games, we are reading those instructions, it's not easy. So you can see the transferability of what we are developing for people with dementia can now be used for people who don't have dementia. But I don't know if I'm answering your question, but how it is going to eliminate the digital divide? It is by including everyone. So when we do studies with people with dementia, we try to include people from immigrant communities. A lot of the work we do is in the Jane and Finch community, for example. A lot of the work is in North York. But if we design for immigrant communities, it will work for people who are non-immigrants as well. So it's a more inclusive approach. Does that answer your question?
Partially, now. Yeah.
What is the other part, which I did not answer?
I think mainly there are so many determinants. Ultimately, the root cause, it is actually so as I was kind of seeing, the root cause is like, once again, the development, the social determinants or the digital determinants of using the technology. For example, when I joined my undergrad, so I didn't have access to phone. So I used to call my parents using the public telephone booth, putting 1 rupee coin in India. Yeah. And then maybe like by completing the undergraduation, so after joining a small job, so I got a small phone, 1100, so Nokia, so through which I used to call. So now I can afford the kind of maybe S24 iPhone or whatever it is.
Yeah.
And so of course that one is the affordability. Then other than that, so I will not take the mobile phones or the laptop as one of the technology which is like going to make the digital divide, because this is a very quickly in the process of theory of diffusion of innovation. So I don't see any laggards. Mostly it's like taken by 100% of the people. But we have other technologies which is actually kind of a lot of people in the late adapters are in the laggards section, which need to be like shifted to the early adapters or the kind of innovators section. So that is how we are going to kind of eliminate or reduce the digital divide.
You give the answer yourself.
Yeah.
So when we come up with ideas, we don't look at just one particular idea. We look at an ecosystem of solution. So for example, if like we did one study where on tele-wellness, a project, a person from rural community said, we don't have Wi-Fi and internet. So then we look at, okay, if we design a technology, there needs to be a service that goes with the technology. So you need to have a service design, you need to have a policy. There's no one solution that is going to solve the digital divide. You need an ecosystem of interventions. And what you said is a very common problem. Your personal experience is a very common problem for immigrants, whether young, old, everyone. People who have lived in this country for 50 years and still they have these barriers that you're talking about. To answer your question, you never design one technology. There needs to be an ecosystem of solutions, technology as well as non-technological.
We have a couple more questions, so I just ask Michael, go ahead. Be brief, and then we'll go to Naima online. Go ahead, Mike.
Yeah, I suspect if medical doctor has made this presentation, his slides would be very different. Trying to get to the fundamental problem. So I understand that dementia is a neurological problem that manifests in cognitive challenges. And I'm interested in hearing what fundamental concepts from design responds to that natural duration, if I may use that word.
Okay, so it's a question for me. So I would say there's two things that's very important. Is that dementia is first of all, the concept of dementia. What are the elements? Yes, there is a cognitive component, very clearly, but it's not simply cognitive. It's cognitive. There's also a neurodegenerative process that occurs with that, and then a musculoskeletal atrophy process that occurs. So because if people are less active, they become less, their muscles are not being used, their tendons become shorter, tighter, things like that, right? So there's certainly a cognitive dimension. There's also a broader physical beyond the psyche and beyond the capacity of the brain to function cognitively. And then there's also a hugely important social dimension, right? So the effect that an environment has on a person and that the person has on the environment. This is a symbiotic relationship, right? And as there are physical and cognitive changes in the person, the nature of that relationship, that symbiotic social relationship changes. And so I think what Shital is doing here, first of all, is actually incorporating that broad concept of dementia and taking very much a broad approach across those three sort of domains and trying to design supports and not just interventions, but supports, I think probably might be a better word for a person in that circumstance. So there's a broad answer to your question. And then one of the things I would just really highlight, that your slide that you had that showed a time sequence analysis of different aspects of a particular task. Like it was opening something and then closing, and I couldn't quite figure out exactly what the task was, but something like that, right?
Yeah.
So you broke down the task into a whole series of subtasks, right? And then you analyzed that over time.
Yeah.
And then you compared people with identified dementia and people with no dementia. And you could see very clearly, right, when Shital presented that for the people with dementia, there was a massive data gap, I guess we'd call it, an absence of activity. Now you can actually, I was looking, I thought, this is amazing, right? This is so useful because it tells you so many things. It tells you what are the manifestations of particular cognitive deficits, right? And you can also then reverse impute. You can say, well, what are the cognitive processes that are implied by this deficit, right? So you can use a behavioral analysis to impute a physiologic a process or deficits in a physiologic process. And then you can also look at you can design prompts right?
Yeah.
At the right time in a particular event. So first of all, you can understand more completely. I mean, I thought this is amazing for the cognitive neuroscientists must be going nuts over this. I love this stuff, right? Because it really helps them understand. But then you can design prompts that support a person through that process, because those deficits, it may not be that there's a very specific cognitive deficit. It may be that there's just one piece of a deficit in the process, the physiologic process, that the thing that catalyzes the response, that may be the place where the deficit is. But if you stimulate, well, then you will get the response, right? So then the prompt becomes extremely important. And so so the neurophysiology and then the sociology of dementia, and as well the broader physical aspects, manifestations of dementia. These are really, really important to understand. And I think every single one of them are in what you've presented, Shital.
So that is exactly the objective, is like, if you see the gap, and this is like, we've been doing that project for like, how many years? Since 2018. And now we are seeing that there is this difference. And, so human-centered design is a long process. So you'll find people who actually do human-centered design, they don't have a lot of publications, for example, because it takes time to get all this results. But also non-clinical approach, right? Like, I'm not doing anything with the human brain. People don't like that. I'm just observing their behaviors and coding it. And that gives me a lot of information. But can I use this gaze information to see when that gap happens and then just throw the prompts?
Yeah.
Right?
So this will be our last question. And Naima, please go ahead. I'm sorry to keep you waiting so long.
No worries. Can you guys hear me?
There's you at the bottom of the screen there. Yeah.
Yeah, okay, you guys can hear me, right? Sorry. Yeah, so thank you so much, Professor Shital. Honestly, you've shared so many gems that I've highlighted on a number of places. So thank you so much for your time and just expertise on the matter. You spoke on sustainability and ensuring that we're challenging it, like when it comes to design, in an effort to promote inclusivity. And it made me think about just like my own research. So my question is just about regarding like global health projects that involve technological interventions. Like given the rise of interest on like LLM models being implemented into like healthcare services, do you have recommendations as to like how we can use participatory design to maintain stakeholder and community involvement throughout the life cycle of implemented systems?
I'm not an AI person.
I know.
But I do use AI, and I have been fortunate that I have had students from different disciplines. So I have students from computer science who are AI, but my postdoc is an AI expert and from computer science. But a lot of these people are not human-centered. So I'm getting him to do this human-centered approach. Now, the problem with AI is, and with any technology, is there's always this backlash about technology is bad. But technology, like in our practice, we always treat technology like a tool. And I always use this example of a hammer, and pardon me if it offends anyone, but and I always say this, like, if you use your hammer to put a nail in the wall, then it's an appropriate use. But if you use the hammer to, break someone's head, then it is the misuse of the individual, not the hammer. Technology is also like that. So you need to design technologies appropriately and use them appropriately. And that's where the ethical use of technologies comes into picture. With AI, a lot of biases in AI or generative AI is because the existing data itself is biased. And I'm not saying that I'm a big fan of AI, but there is a problem. The bias already exists. Like we know a lot of BIPOC faculties or researchers are not cited enough. If you search on any topic, mostly they are white male research, citations that ChatGPT will throw up. But these biases are there in the system. We know that white male researchers have more citations than the other ones. So what do we do about it? So when we are training these AI agents which are being developed, we need to train them again in the more inclusive approach. Include people in the red zone, and so that means it will work for the people in the green zone. I don't know if I'm answering your question, but you need to train these AI agents with lot more people, lot more samples which are more inclusive, rather than just testing with the green zone. And I know a lot of people in human-centered design I have met, or even life-centered design. It is easy to recruit participants in the green zone. So, and I've had so many students come and say, oh, doing research with people with dementia is difficult, or doing research with people with disabilities is difficult. So we have a lot of projects where we have people with speech impairments, for example, a new project that we are starting. But what we have seen is there is and I'm not digressing from your AI thing, but I'm giving an example. Like we were talking about communication technologies that people with speech impairments use. We had people using this Apple app.
Proloco 2.
What is it called?
Proloco.
And I have this impairment where I cannot pronounce that word. And I have to always ask Ruksha, what is that word? $90 app that you can download on your mobile phone or any device or iPad or something. And we had some people who were not using that. They were just using email as a communication on their mobile phone, not even laptops. And we had one participant who said, oh, she started getting a mobile phone only when she went to university, because she was never given. You can imagine how she went through the schooling system. Schools not allowing technologies in the classroom. What is a person with speech impairments going to do in that class? So you start seeing this affordability, accessibility of resources come into picture in terms of, inclusivity and accessibility domain. So how are you going to design AI for people with speech impairments? So we're talking about, okay, we need to design AI agents which will help this person with speech impairments to use predictive text, for example. How are you going to use this technology if people can't afford to buy a $90 app, right? So you need to look at more systemic systems design is important, and inclusivity of all the participant groups from different social, economical backgrounds involved in all the stages of the study, which means you need to develop a partnership with these people. They're not going to just come out of nowhere and say, oh, I'm going to participate in your study. So community building is very important if you want to work with the community, and we spend years and years developing that community network. Does that help, Naima?
It does. Thank you so much.
Well, thank you so much, Shital. That was an excellent presentation. And the readings as well that you gave, very powerful. And this presentation really helped kind of encapsulate all of that into a nice kind of conceptual package. So thank you for the presentation, but also for the time that you took in preparing the readings and categorizing them with me, but mostly you. I mean, you really put a lot of effort into that.
I have to say, Ruksha also helped me.
And
you.
especially for your list of interpretive terms, that was that's pretty helpful.
You'll notice that a lot of the articles are addressing designers directly. So they're not really written for general audiences. They're written for designers doing design research. So
you will also notice that everything is so multidisciplinary. I don't do this all work myself. I have students from different disciplines, but I also collaborate with people in global health. But also I work with people in vision science at CVR, people in sciences, for example, but people in health. people in AMPD. I think I'm working more with people outside AMPD than within AMPD. I think I should have some more people from arts, but it's multidisciplinary. And Mike was talking about, like we need to have healthcare practitioners involved as well, because they know the health part better or the cognitive science part better. I'm not even a designer. I'm an engineer, but I do a lot of design work as well. Not a graphics designer. So maybe sometimes we have graphics design students help us develop models for the cat, for example. That's why, Rupsha is multidisciplinary now. Like she's like design. She knows how to design, develop technologies now from global health perspective. So having a multidisciplinary perspective is very important. So step out of your disciplines. It's not that bad. It gives you a lot more opportunities in terms of jobs as well when you graduate. But yeah, it was nice being here. Very engaging discussions. I've normally gone to sessions and people are very quiet, but this was really nice. So thank you very much. Always challenge people who are talking in front of you. It's always good.
And the key, I think, for global health, global health is very much a multidisciplinary practice and conceptual domain, but also practice. And the design, as Shital has presented it, there's a natural kind of marriage, right, between the thinking and the approach of global health and the methodologies of design. And there's also, in the framework that Shital has presented, she's chosen language, that allows for disciplinary expertise to also feature, right, as necessary, but it is from a multidisciplinary perspective. That doesn't mean that there aren't disciplinary areas of expertise, right? And so that's the value, that's the beauty of it. And it really is a beautiful marriage, really, between the kind of conceptual framework of global health and the design and the conceptual framework of design. So thank you so much, Shital, for presenting.
Thank you. And I have to say, James was actually the first one when I joined in 2019 to approach me and say, this is possible. So, and from there on, I've just kept on working. So global health was the first partnership for me. And then I have, people were more and more people were interested. So I'm like, you see, I'm there in STS, liberal arts as well. I'm like labs and sciences. And people come and say, oh, you're everywhere. Like, what are you doing? I said, I'm doing what I should be doing.
Doing design.
Started with James, I have to say. So, thank you, James.
Excellent.
It was very helpful. I never planned it that way, but James did give me that direction. So thank you.
That's great. Good. Terrific. Well, thank you so much, Shital.